Okay. Well done.
When Church of Uganda Family TV visited Hoima Regional Referral Hospital in the center of Hoima City, we found some of the patients and their caretakers lying on the hospital floor, especially in the children's ward. The Hoima Resident City Commissioner, Badru Mugabi, visited the hospital and interacted with some of the patients and their caretakers who raised a number of issues, including being told to buy drugs outside the hospital since there was a stock out.
We were told by doctors to find other means to buy drugs so that our children can be treated. We came here on Thursday, but we are buying everything outside the hospital, starting from Panadol, syringes, cannula, among others. We don't know how the government is helping us.
Today you are here as our journalist. Tomorrow your wife will be here.
True.
And you'll find time to call Dr. Waga. I'm here, my wife is. I'm like, okay, I'm there, but even my doctors are there. We are working, so and work closely. That is the environment we want. Support us mentally. Psychologically, we need that support.
Despite the challenges, the Hoima Resident City Commissioner, Badru Mugabi, said that he was impressed after finding majority of the health workers at the stations. He said reports that the hospital was in a bad state had been grossly exaggerated.
We didn't even find interns as alleged, but we find the doctors and nurses substantively in post treating patients. However, we found a serious concern of drug stockouts, and the response we received is that National Medical Stores has not yet delivered their 5th round of drugs to Hoima Regional Referral Hospital.
Dr. Ibrahim Bwaga, who received the resident city commissioner on behalf of the hospital director, said that the hospital is overwhelmed by the high number of patients coming from the 11 districts of Bunyoro sub-region and others, including Hoima, Chikube, Hoima Oil City, Chiboga, Chankwanzi, Masindi, Bulisa, Chiriandongo, Kagadi, Chivale, and Kakumiro. Others come from eastern DRC.
Numbers have increased, and therefore the demand for services has equally increased. And we are informing government to also increase the funding to this regional referral hospital, such that the funding should be commensurate with the catchment of this regional referral hospital.
Because we want to give you the better option of the care that we are giving you, we have to write for you the drugs that we think would best suit the patient. And if they are not here, that is why we tell you sometimes, please, if you can, please buy this drug. There are some options, but would you love an option that is suboptimal to your patient?
Dr. Ibrahim Bwaga said that many patients walk into the referral hospital irregularly without referrals from general hospitals. Another factor is the failure by low health centers to manage small cases, and the patients end up at Hoima Regional Referral Hospital.
This hospital is a regional referral hospital. So the crowd here means that there's something not being done right at the region, where at their districts. So the congestion here can only be decongested if the districts do their part.
He has asked the central government to increase funding for the referral hospital since the population of the catchment area has also increased. Dr. Ibrahim Bwaga, the acting director of Hoima Regional Referral Hospital, appreciated the medical workers for their dedication to their work despite a few challenges.
If you come and someone has told you from the villages down there, you go to the hospital, they are going to operate you. You get that there is a difference. So when you come to hospital and the doctors, one of them, the surgeon, has just entered here. She has entered here to operate patients. When you look at this patient, does she look like, usually the abdomen is this and all this. I'm not saying that, but we should treat this information with some content.
Hoima Regional Referral Hospital was upgraded from district hospital in 1994 and serves more than 2 million people from Bunyoro region, parts of Buganda and parts of eastern DRC.